All right, so we're going to go back here. So welcome again to our chronic pain workshop. We're just going to start off with some introductions so you know who we are. My name is Kayla and I'm the occupational therapist here at the Virgil site. I take clients from the Virgil, Niagara-on-the-Lake, and the St. Catharines sites, if you're from one of those. So a little bit about me. I have been here on the family health team. I work part-time. I've been here for almost 4 years now. Time flies. 2 years were during the pandemic times. Oh, someone else is joining us.
That's okay, I got it.
Okay, perfect, thank you. And so throughout my time on the family health team, I work with individuals of various ages, different backgrounds and experiences. So as part of this workshop, I have worked individually with clients with chronic pain. Margaret and I have also done a previous group with individuals with chronic pain, and we've also done a previous workshop as well. I've also done some education and webinars through our college in relation to working with individuals with chronic pain. All right, Margaret, would you like to go ahead and introduce yourself?
Sure. So my name is Margaret Heckela. I'm the occupational therapist at the Wella McMaster Family Health.
Okay.
Just mute him. Can you mute him?
Yes, I did. Yeah.
All right, so I'm the occupational therapist at the Wella McMaster Family Health Team. So I have actually been at the Family Health Team 10 years this month, so my 10-year anniversary. So I've worked at other facilities in the past. So I've worked with chronic pain individuals for a number of years, so familiar with many of the issues around managing chronic pain and some of the challenges around this. I've also had some of my own experiences around dealing with pain from a personal perspective, so can relate in some ways. Obviously, everybody's pain experience is different, so we try to consider all of the different aspects of pain as much as possible. And if you can gain something from this today that is of benefit to you, that's our goal. Hopefully we can help you find some strategies that work for you. Okay, we just skip.
All right, so we just wanted to start off with defining chronic versus acute pain and what the differences are between these. So starting with acute pain, this is a type of pain that's experienced for less than 3 months. It's typically symptom-based. It has an identified cause and your body responds to that pain, and it diminishes with healing and responds to treatment. So some examples of acute pain could include if you fell off of your bike and you broke a bone, or if you were cooking and you burnt your hand on the stove. So with that pain, you're going to experience it, but it will likely diminish over a couple days or a week or two. For chronic pain, this is something that lasts longer than 3 months. It is a condition. It may develop after an incident, and it may have a known or an unknown cause. And it's something that persists beyond the expected healing time, despite treatment. So some examples of chronic pain could be chronic low back pain. It could be someone with fibromyalgia. So these conditions aren't just going to go away in a few days or a few weeks, but they're going to stay with us long term. And they can really affect how we function in our day-to-day lives. So we really have to learn how to manage these conditions. So I have a little video here as well for those of you who are visual learners. So if you'd like to turn up the volume on your computer, that would be great. And I will play this right now.
Kia ora, talofa and welcome. I'm Dr. Janine Bycroft from the Health Navigator team, and in this short video I'm going to explain the difference between acute and chronic pain. Pain is something we've all experienced at different times, and while no one likes being in pain, it's actually an important protective mechanism to keep us safe and reduce further pain or injury. Pain can be acute, short-lived, or chronic and ongoing. It's important to know which type you have because the treatment options are quite different. Acute pain is your body's way of warning you that something is wrong. It often comes on rapidly, lasts for a short time and then goes away. It's usually caused by something specific such as an injury, infection, surgery or an illness. This contrasts with chronic pain where the cause is often unknown or more complex. Pain can be described in many different ways for both acute and chronic pain, from sharp or stabbing to a tightness or burning sensation, an aching or throbbing. Chronic pain is pain that persists and you experience most days for 3 months or more. It can range from mild to severe, be constant or come and go. Living with chronic pain can be hard work, but many people with chronic pain do get better and most can lead normal lives. It is often described as pain that does not go away as expected after an injury or illness. Chronic pain is thought to occur when nerves become oversensitive and keep sending warning messages to the brain even when there's no injury or after the original injury causing the pain has healed. The brain thinks there is harm and reacts by feeling pain. In other words, the fire has been put out, but the fire alarm is still going off. Treatment for acute pain will depend on a number of factors, such as what is causing your pain, where it is located, how severe it is, and your personal preferences. Treatment options typically include pain relief medicines such as paracetamol for mild to moderate pain, non-steroidal anti-inflammatories such as ibuprofen, naproxen or diclofenac, which can help reduce inflammation and swelling. For acute injuries such as a sprain, you'll find the RICE approach useful. R is for rest, I is for ice, C is for compression, and E is for elevation. Bandages such as a crepe bandage or tubie grip can be used to provide compression and support. A sling or pillow can be used for elevation. For chronic pain, treatment is more complex. Chronic pain is often described as a cycle, where persistent pain often leads to one doing less, which leads to loss of fitness, tiredness, and less energy. This often leads to poor sleep, feelings of frustration, anxiety, low mood, stress, or anger, which results in more increased pain. The increased pain then causes you to have more low mood, tiredness, and stress, so you get caught in an endless cycle. The good news is there are several ways you can approach managing and treating chronic pain to start feeling better. Treatment of chronic pain needs a broad approach and takes into account your mental, physical, and emotional needs, and identifying each of the areas you can do something about. If you think you have ongoing or chronic pain, see your doctor or healthcare team to help work through what approach will be best for you. You can also see the next video in this series on tips for managing chronic pain.
All right, so I hope that video was helpful in explaining the difference between acute and chronic pain. Again, if there's any questions that you have, feel free to write them in the chat box or write them down and we'll go over those at the end as well, okay?
Okay, so during that video, she spoke quite quickly, so we'll touch on some of the main features of the chronic pain condition. So our little cartoon there, let's tell each other which parts of our bodies aren't aching. So oftentimes pain can be all-consuming, and it's forefront in your brain. It's always kind of there. It's never going away. It's something that you talk about or think about quite often. So that kind of speaks to that. So, the other concept I want to try and get across is the fire has been put out, but the alarm is still going off, and that's with chronic pain. So the initial cause of the pain is no longer the reason for your chronic pain condition. Your tissues may have healed. The fracture or injury that you've sustained has actually healed, but the system is still heightened. The nervous system is heightened, and you still have that flame response, that chronic pain overstimulation of the nervous system. So it's one factor that sometimes explains this well is the phantom pain phenomenon. And if you've ever heard of this, is if somebody's had an amputation, say their leg amputated or something like that, they often experience what's called phantom pain after. So they still feel pain in the feet or the lower leg, even though that portion of the body is not there. So it is kind of that nervous system response to the pain condition, and that's that it's a chronic condition as well. So that kind of explains it a little bit further. Okay, next slide. Okay, so let's look at the pain pathway, because this can help sometimes to explain pain as well in terms of the chronic pain system. So typically, if you were to stub your toe, you would experience pain. And so that would be called nociceptive stimuli. So you have some type of pain response to, or response to a painful stimuli. You stub your toe, your body at the foot, the nerves take the message through the afferent fibers in the leg, up to the spinal cord, and up through the brainstem all the way to the brain. And then your brain tells you, oh, I feel pain in my foot. When it's stabbing or it's sharp, the brain tells you what it feels like. So that's the pain pathway. But with chronic pain, the nervous system becomes oversensitized. So there's sensitization of the nervous, pain pathway. So then if you may have a lower pain threshold, a lighter type of touch or movement causes a pain response. So rather than that stubbing of the toe, you may just move the foot and you feel pain. So your nervous system becomes oversensitized to pain, and that's, you're feeling that it's more of an ongoing pain response, okay? So we'll move to the next slide. So our pain responses are a response to information from our body when our brain considers that there is a threat or potential threat to our well-being, and something must be done. Okay, so with the sort of the pain response, and then the whole, it's kind of pain and stress. So when there's pain or a stress situation, your body gets heightened. Your fight or flight response takes over, usually if you have something that's your body needs to respond to because there's a lot of pain or there's a stressful situation. So it's that fight or flight response, or the sympathetic nervous system is heightened. When you have chronic pain, your pain response is always in that heightened state. So your sympathetic nervous system or your flight or fight response is always turned on, or not always, but pretty much most of the time. So that's, it affects you at your hormonal level. There's increased release of hormones. The adrenal gland is heightened. There's an area in the brain called the amygdala, which is heightened during the flight or fight response. So there's all that heightened feeling. Whereas the other side of the response in our bodies is the parasympathetic nervous system, which is more of that rest and digest part of the nervous system. So calming, where your body can take time to digest food, where your blood pressure comes down, where your heart rate comes down, when you relax. And what we would like to work towards is having more of that parasympathetic response in our bodies, so that you're dampening that heightened fight or flight or sympathetic nervous response. Okay, so move to the next slide. So this is again carrying on from that, the threat response. So when you have pain, some of these things that cause you potentially to feel that heightened response, stress or pain response, may have anxiety and fear around that, around what's happening to you. I'm not getting better. I can't work. I can't do the things I used to do. Causes more of that anxious type of feeling. You may be looking for answers. You may be looking for your doctor to tell you what to do, or an explanation as to why you're still having pain. There may have been failed treatments, which causes more of that heightened threat response. You may have financial concerns, job issues, as I mentioned, and it's that constant stress or pain response, the heightened sympathetic nervous system response. So that's kind of getting that tied in together, pain and stress, and how it affects you in different aspects of your life. Okay, move ahead.
You can visualize this lion now. I always love that picture. So thinking about our brain, there's so many different factors that can influence our perception of pain. So looking at our sensory information, our beliefs, our memories, our emotions, and our thoughts. So breaking that down, our sensory system, that includes our taste, our smell, our sight, sound, and touch. So these things can influence our perception of pain, as well as our beliefs. We're all raised in different environments. We all have various belief systems, and that can play a role. Our memories, whether they be positive or negative, right? They can impact our perception of pain. So take, for example, someone who has a fear of needles. That might be from a memory of a traumatic experience as a child. So the next time, say you have to go get a needle, such as for your COVID shot, your brain may trigger and think back to that past traumatic or that painful experience, thus leading into emotions and thoughts. So we might feel anxious, we might be worried, we might have these thoughts that pop in our head thinking, oh, is this going to hurt again? I don't want to do this. So those are all some different factors that can influence our pain and our perception of it.
Okay, so we're going to take a breath break, and I'm going to lead you through some breath. So breath in and of itself is so important in terms of bringing a change in your response system, or your bringing that relaxation response can help you in managing pain. So I'm just going to take you through a little bit of a breath break. So if you can move yourself into a comfortable position, try to stay in seated, but allow yourself to sit upright in your chair, just comfortable. Let your hands rest in your lap. Remove your glasses if you'd like, or just whatever makes you feel more comfortable before we start the actual breath. And you can keep your eyes open, or you can close your eyes, whatever you prefer. And I'd like you just to bring your attention to the breath coming into your body. Notice as the breath moves in, and then the breath moves out of your body. And notice the breath moving in through the nose, down, filling the chest all the way potentially to the belly, and then the breath moves out again. Paying attention to those different parts of your body involved in breathing, from your nostrils, moving potentially through your throat to your chest, to the belly. Breath in and breath out. And now I'm going to draw your attention to the diaphragm. So the diaphragm is an umbrella type muscle between your chest and your abdomen. As you breathe in, taking a full breath, your diaphragm moves up towards your chest, and as you breathe out, the diaphragm releases down towards the belly. So just if you can notice or pay attention to that area. Noticing, if you can, the drawing up of that muscle, that diaphragm up through the chest as you breathe in. And then releasing as you breathe out. And now from there, just continue taking a couple more breaths in, noticing the expansion of the belly and the ribs. And then breathing out and releasing. And now I'm going to invite you to try counting the breath a little bit. So as you breathe in, try to count to 3 first. So let's go breath in, 1, 2, 3, and breath out, 1, 2, 3. And just try that for a couple of repetitions, counting to yourself, breathing in to the count of 3 and breathing out to the count of 3. And now, if you can, try to expand further to see if you can build up to the count of 4. So breathing in, 2, 3, 4, out, 2, 3, 4. And then just continue counting with the breath on your own for a few more breaths to the count of 4. And now finally, let's just add a little bit of movement. I'd like you to shrug your shoulders up towards your ears as you breathe in. And then release the shoulders away from your ears as you breathe out. Try that again. You can use it with the counting. Breath in, shrug up, 2, 3, 4. And breathe out, release. Let go, and to the count of 4. And just do a couple of more on your own. Just trying to breathe in and release on the breath out. Okay. So that was a little bit of a relaxation for you, a breath practice. One of the tools that can be of benefit to you if you're dealing with chronic pain. Okay. So we can move on to the next slide, Kayla.
All right, so the pain cycle. As you can see here, we have pain in the very center, and then all around it here we have our thoughts, activity limitations, lifestyle, medical management, emotions. These all interconnect and they're all influenced by this circle here, the pain. So that's why it's in the center. So breaking this down, looking at activity limitations to start with, if we're less active, this can lead to weakness, can lead to low energy, might be muscle and joint pain or stiffness, some changes within our posture, and just that overall deconditioning of our body when we're doing less activities. There might be also that potential for weight gain when we're doing decreased activation. Looking at our lifestyle as well, so breaking that down into social, leisure, vocational, or job, habit changes. Socially, right now, our lifestyle might be different given the current circumstances. When we live with pain as well, we might not feel like being very social when we're living with a lot of pain, or we might not have that motivation or desire to do things that perhaps we previously loved and enjoyed for leisure. In terms of habits, sleep can be interrupted due to pain. It can affect our emotions, our thoughts as well. And that can impact our sleep habits. And we'll talk about sleep hygiene as well a little bit later. Medical management. So as you can see, get rid of or fix the pain. That's what we hope for, right? We hope to have that magic pill that will just get rid of it all, fix it all. Unfortunately, that's not the case. Yeah, sometimes we're trying all the options and we just feel like there's no relief, or we're just told to learn to live with it. And that can be hard. And that can affect our thoughts and our emotions. So for example, we might experience some anxiety, go through depression, sadness, frustrations, and just feeling hopeless at times. And this can affect our thoughts as well. We might have very pain-focused thoughts. We might think very negatively and have a fear for the future as well.
Okay. So we're going to talk about activity patterns in some greater detail. So some of the typical ways of responding to pain or chronic pain when you have this for long periods of time is you may stop doing activity. You may avoid movement. You may avoid walking. You may avoid the normal things that you enjoy doing. And that's, we call that category more the underdoers. So the people that don't do very much. They find pain causes more, or activity causes more pain, so they avoid activity. The next class would be the doers. So the people that push through pain a lot. May take a lot of medications to help them manage because they want to keep doing things, they want to, or they feel they have to, and sometimes they feel that pressure because of financial reasons or whatever else. But they're doers, they tend to push through the pain a lot, and there's a lot of that cycle. So again, with you can see the green on that graph is the doer. So they tend to fluctuate between doing a lot or doing nothing. So they, and that actually leads to the high cyclers as well. So those are people that stop doing, start doing, and you may find that that happens with you as well. So sometimes you do a lot and you try to push yourself on a good day, do a lot of activity because you're feeling a little bit better. Then the next day is feeling a lot of pain because you've pushed yourself a bit, and then you do nothing or you do very little. So there's that high cycling, doing a lot of activities to very little activity. So you can see on the graph, there's the colors are connected with each of those types of cycler or doer activities, and you can see how that relates to pain and activity. Anything you want to add about that, Kayla?
I'm going to try this poll. I would love to see, it is anonymous polling, if you'd like to answer what kind of activity pattern you feel you can relate to based on Margaret's description there right now, where you feel you fall. So I hope everyone can see and access this. So the question is, what activity pattern do you identify with right now? Do you feel that you're an underdoer, a doer, or a high cycler? So you can just click on one. If you feel that you may be multiple, I think you can click on multiple as well. And then
I think it's best though if you just click on one. Just choose one.
Okay, so I'm going to launch the poll. Oh. All right, so there we go. Should be able to answer. Okay, perfect, they're coming through. All right, it's slowing down. Looks like lots of doers and high cyclers.
Yeah.
Wow, 40% and 53. Okay.
We have 15 people responding. Anybody else?
Oh, a couple more.
Okay.
So a lot of people in that boat of doing lots on a good day. You're feeling good and you're gonna go and do all your errands, and then the next day, stuck on the couch, not doing a lot. All right. Thank you everyone for responding to that.
Okay.
So thinking about our optimal activity pattern. So move that out of the way. Where we want to be at. So we looked at the previous charts. So going back here, right, with our underdoers, doers, and our high cyclers, and they're color coordinated. So now, what kind of activity pattern is optimal? We want to be that medium cycler. So what does that mean? So here you can see on the graph, kind of staying in the middle, not going all the way up, all the way down, super low there. So medium cycler is where we want to be at when we're managing our pain. So this is when we're still able to do the things that we want and we need to do. So we're doing a small amount of an activity on a good day and then a little bit on a bad day. So we're not doing everything on one day and nothing on another day, but we're kind of spreading it out there and managing it. We're finding that balance. It's working towards finding that balance between activity and rest. And we're going to talk about as well how pacing is involved with this and how to do so to help us to kind of become this ideal medium cycler or this ideal optimal activity pattern. Anything else you want to add to that, Mark?
No, that's good.
Okay. The patient to person approach. Yes, as OTs, we're very client-centered profession. So we want to move away from how to fix your pain, which might be the approach that your doctor might be coming out with meds. But we focus more on how to manage to live with it and that self-management piece of your pain condition. Because we know that there's no magic pill, there's no one size fits all. Everyone's situation is different and everyone living with chronic pain has a unique experience that they bring. So in order to live and to feel better, we have to take that initiative, take an active role and hold ourselves responsible to our actions. So as OTs, we move away from symptoms, which symptoms again might be other healthcare professionals focus on, such as your physician, but we look at more at function. So we're function focused when working with people living with pain. So we look at how to manage risk factors such as taking into account diet and lifestyle habits, looking at proper body mechanics, ergonomics, pacing, how to conserve our energy. So for example, to be able to still do something, even on a bad day.
So I think Kayla's touched on some of this in the last slide as well, but our role in terms of occupational therapy around managing chronic pain is, first of all, looking at coping strategies. And that can be a variety of skills that can work for each of you, and everybody's a little bit different. So possibly dealing with the thoughts and emotions piece, you may have to address some of your thinking patterns. Coping skills can also be using a strategy that helps you to manage your pain, such as stretching, such as using heat or ice or different kind of modalities, or changing something in your daily routine. So coping skills can vary. Pacing is a big part of what we try to impart to individuals, and we'll be talking about that a fair bit today. And I'm sure some of you have some familiarity with pacing, and I've heard people say they try to pace themselves. But sometimes even with trying to pace yourself, you're still doing that high cycling thing where you do a lot on a good day and very little on a not so good day. And so there are some things that sometimes you can add to your pacing strategies. Activity management is sometimes setting priorities for yourself, planning your day, looking at how you do things so that you can change your pattern of activities, sometimes to change your response to pain. Relaxation techniques, so the breath is one relaxation technique. There's many different types of relaxation strategies. We also teach mindfulness. It promotes relaxation, but it's also a method of learning how to address thoughts and emotions as well. So that's another way of looking at managing pain. Also, one of the things that we'll encourage you to do even by the end of the session is to start to think about your goals. What is your goal for trying to change something in your life or manage your pain? What is your goal for pain management? And goal setting is something we encourage people to focus on. And the goal may be to get rid of your pain, but that may not be a realistic goal. Maybe a goal is to learn how you can change something so that the pain is less forefront. It's less of an overall problem that you deal with day to day that is so consuming. And then the pain management strategies, I think we've kind of touched on overall, and recommending use of assistive devices. So we may suggest to you that instead of bending, you use a reacher so that you don't bend as much, or there may be other types of devices, whether it's even a splint for your hand, or just using a lighter vacuum cleaner, for example. So there could be a lot of different types of things, and it's very individual to a person's difficulties that they're experiencing with their daily activities.
So the whole person approach. So this is a diagram of a model that we as OTs use that's called the PEO model, the person, the environment, and the task or the occupation. So when we work with individuals, we break it down in terms of these categories, and we also show how they all interconnect, the person, the task, and the environment. So looking at the person, there's the physical aspect of the person. So that can include your posture and positioning, pacing, stretching, sleep hygiene. There's the cognitive aspect of the person. So that may include stages of change, where that person's at cognitively. Are they at the point of acceptance? Doing some problem solving together, challenging different thought patterns or distortions in relation to activity and pain. And then the emotional aspect of the person. So like Margaret mentioned, working through relaxation strategies, maybe even some stress management with the individual. When looking at the task, there's the physical task. So that can include time of day, how many steps you're taking, how long are you doing that task, are you pacing yourself during it? The cognitive aspect of that task. So cognitively, what's required, what tools are you using, how are you prioritizing, etc. The emotional aspect of the task, what meaning does that task provide to you? What kind of emotions do you express or take on during that task? And then there's our environment. So the physical and the cognitive aspect of the environment. So the location of it, the setup, different heights, maybe different devices you're using, Some people use timers as cues to remind them. Social as well, the social aspect of the environment. So are there other people around you? Now, for example, for jobs, you might have worked in cubicles with individuals, and now you're working behind a screen by yourself. So that social piece might have changed a little bit, which is why we added the social and virtual. Now we're going virtually a lot as well. And the institutional aspect of the environment. So there's always funding and policies that influence that as well.
Okay. So we're going to take a little break, and if you need to, obviously you can take this opportunity to move around or get up and walk, but we're gonna take you through some stretches that may be of benefit to you. And everybody, I mean, we haven't asked you where your pain is and what your pain experience is, and that's not what this workshop is about. But we're gonna go through some stretches just overall that may be of benefit. Obviously, go with your body, listen to your body, don't do anything that causes more pain, and also go to your own comfort and limitations. So we'll just do some gentle stretching, okay? So again, just bringing your attention to your breathing, taking a breath in and out. And I'm going to take you back to the shoulders. So take a breath in, shrug the shoulders up, and then release. And just let your shoulders fall away from your ears and let go. And you can do a couple of those on your own. Breathe in. And let your shoulders release and let go. We tend to carry a lot of stress in our shoulders, so it's important to try and bring breath and some movement into that area. Okay, so I'm just going to now ask you to take your attention to your neck area. So just bring your chin forward towards your chest as far as is comfortable for you. Now take a breath in and just looking up towards the ceiling, not going back too far, but just within your comfort. And then breathe out and bring your chin forward towards your chest again. Just getting a little bit of a stretch, gentle flexion and extension into the neck, using the breath as you move. And sitting at a screen, at a computer, so it's important to get some movement in the neck. And we do encourage you to use stretch breaks throughout the day so that you can tolerate activities a little bit better by changing some of the positions in your muscles or your body. So now just bringing your left ear towards your left shoulder, getting a side neck stretch. And then bring your head back to center. And then release your head towards the other side, or so right ear towards right shoulder. And then just move back and forth a couple times with the breath, ear to shoulder, getting a stretch through the side of the neck. You may notice some tightness there, some discomfort, but just breathe into it and just go with how far your body can allow you to move, to stretch, to release if you can. And then coming back to center. And now take a breath in. And as you breathe out, just look over your right shoulder as far as is comfortable for you. And then come back to center. Breathe in and breathe out and look to the left shoulder as far as you can. And back to center. Breath in and breathe out. Look over the right shoulder. Now take a breath in here. And as you breathe out, just let your chin come forward towards your chest, letting it round forward. Just releasing all the way around to look over to your left side. When you get to the left, take a breath in. And as you breathe out, just let the chin roll forward through your chest and then back over to the right side. And do that one more time. Breath in and then release forward, rolling through the chest. To the left, breath in, and then release, chin forward and down and around. And then take a breath in and come back to center or neutral. And now I'm going to ask you if you can give yourself a little hug. So bring your arms across your body, take a breath in, and just maybe flex forward slightly, coming forward and pulling your shoulder blades apart. You maybe can feel a little bit of a stretch between your upper back, between your shoulder blades. And just breathe into this area. We tend to also carry a lot of tightness. If you don't have this range of motion in your shoulders, you can just try and stretch in as much as you can through the shoulder blades, okay? And now bring your arms back and open your chest forward, pull your elbows behind your body so that you're just bringing your shoulder blades together now. Okay, so chest up and just pulling them in and taking a breath here. So you might just feel that. So those are some movements that you can do back and forth. You can hug yourself or just moving back and forth. Shoulders retracted and protracted or forward and back. Okay, so some movements. And then let's get into some shoulder rolls. So feeling that movement into the shoulders. Maybe some tension there, breathe into it, and then I'll go the opposite way, just rolling into it. And again, working within your range of motion and your pain levels. Okay, and then if this is accessible to you, you can do a little bit of a stretch in the back of the arm or the triceps area, just bringing the arm across the body, using the other hand to just give a little pull. Feeling a bit of a stretch through the back of the shoulder and into the triceps. And then you can just go to the other side, nice little stretch. Okay, and then release. And then let's bring our arms up. Again, go as far as your body will allow, breathing in. And then releasing and breathing out. If your range of motion in your shoulders is reduced, just go as far as your body will allow. Breath in and release. And now moving into standing, I'd like you to first take a breath. And then as you breathe out, using your arms if you need to, just come up into standing, being gentle with your body, releasing as you breathe out and stand. If you're comfortable in standing, if your body will allow, I'm going to encourage you to stand to the back of your chair. So your hands are on your chair and you're just getting support to the back of the chair. And then just take a step back so that there's about 1 to 2 feet between you and the chair. And now you're just gonna do what we call like a cat and a cow. If you've ever heard of that movement in your stretches or in yoga that you've done, you're gonna round the back like a cat. So stretching into the back, rounding the back. And then draw your chest forward so that you're looking up. And then just hollowing your back. So you're extending a little bit at the neck, drawing your weight up towards your toes, chest is up, and then what they call the cow posture. Okay, so rounding and hollowing, just get some movement into your back, using the breath with each movement. So breathing in one direction and breathing out in the other one. And just getting a little bit of movement into the spine. We've been sitting for a while. Sitting is actually very demanding and hard on the body. It actually is a static posture that can sometimes cause more pain. So we want to move, get some blood flow, get some oxygenation to the muscles. So movement is very important. And then just finally coming to an upright position and just do a little weight shift. Just shifting your weight from one foot to the other if that's comfortable for you. If you have pain in one side versus the other, just be cautious. But just gently shifting your weight back and forth. And then you can continue with that, or if you want to just do a little rotations, if that's comfortable and accessible to you, you can just do a little bit of movement. Just getting your body warmed up a bit, just getting some breath into your body, some oxygen, some movement. Okay. So we've had our movement break and we're going to come back when you're ready to sitting. Okay, welcome back. Hopefully that was okay for each of you. But we want to just encourage you, if you have stretch routines already, try to use them. Even you can do a couple stretches through the day when you're feeling a little bit of tension or tightness. Really important. And I encourage people who are sometimes still working, they need to take micro breaks to stop, move, or stretch. Very important to help in just getting, managing the tightness, the stiffness, the pain issues. Okay, go ahead. You can move on.
All right, so what is activity management? Activity management, so it's all about learning how to manage and be able to complete the activities that we want or we need to do in our day-to-day lives while living with pain. So with activity management, what are we working towards? We're working towards optimizing our function, enhancing our quality of life, and breaking that vicious pain cycle.
So we're going to talk about graded activation. So this type of technique works, is directed usually at people who do little activity. So more of that underdoer type of person. So starting to gradually condition yourself or increase your activity tolerance by first establishing a baseline. So a baseline, let's say if you were trying to increase your walking, for example, say you only can walk, now you're not walking much at all. You might just walk in your house. You just walk to the car. You don't go in any further than that. If you wanted to increase your walking, and if that was a goal for you, you might say, well, I don't walk much now. Maybe my baseline might be 5 minutes. Or if you try to walk 10 minutes and that's too much, you know that your baseline needs to be lower than that. Okay, or if you try 20 minutes and you have pain increase or an increase in your overall level of pain, you know that that's too much. Your baseline needs to be lower, and you try to walk either half that amount or a certain lower level of activity so that you're not constantly causing more pain. And then you can gradually increase that by doing it regularly. So if it was walking, for example, you might walk 3 times a week for 5 minutes or 10 minutes, whatever your baseline is. And then you might find that you're feeling okay with that. You might add a couple minutes the next time and do that for a while and gradually increase it. And then there's gradual increase in activity. You also may need to plan whether may not be walking, it may be an activity such as making a meal. You make a plan for breaks. and you stick to your plan, not pushing beyond what your activity tolerance is, what your pain levels allow, so that you're not pushing into that, beyond that pain threshold on a regular basis. And then you just, each day or each few days, each week, you start to kind of monitor what's the changes. Am I doing a little bit more? It's not about, is my pain changing always? Am I doing a little bit more? Am I able to do more in terms of whether it's the meal preparation or it's walking or it's something else? Maybe I'm doing something differently. I'm able to start to change it. And then there's also the important part of that is setback management, because with pain, we always have setbacks. It's not progressive, always the same on that kind of that graph where it's always the same, always going up, that you're going to increase the activity level. No, you might have more pain, and then you have to maybe adjust for that when that happens. Okay.
In terms of pacing ourselves, so what is pacing? Pacing is that gradual increase in activity that does not increase our pain. So the goal is to maintain that pain control to help decrease fatigue, as well as improve our activity tolerance. It is a safe level of activity that's within a specific time frame appropriate to you and your body. So breaking it down into steps, the first step is that body awareness and recognizing pre-pain signals. So for example, as Margaret mentioned during the exercise, recognizing where that tightness is in your body, or if you're feeling a burning sensation, for example, where is that in your body? And second, preventing the onset of more pain once you notice where that is. So this is where you apply the strategies like we practice, for example, just the stretching, as well as the deep breathing, in which we practice a combination of the two. And this is just one example.
So in terms of avoiding the overactivity cycle, so this is, I think, a number of you identified with that high cycler, or maybe pushing yourself to do more on the good days, or sometimes feeling that you have to get things done. And that is not unusual. I think we all feel like, you know, I'm having a good day. I want to get this done, so I'm just going to get through it. And the important thing, though, is to recognize that the next day you've pushed too hard and you've engaged in overactivity. And that's where pacing can really make a difference. So yeah, I'd like to get that thing done. So maybe I'd like to, let's think of an activity. I'd like to, I don't know. For me, it was maybe recently I wanted to clean up my closet. So everybody has a different activity they maybe like to get done. So if it's something that you haven't done for a while and you wanted to do it, you might do it on a day that you're feeling good. So you do it all in one day, and then next day you might feel good, you've got that done, but you're suffering. So we want to prevent some of that suffering. So how might you change that? So maybe you could do a part of it. So I'm going to do this section for half an hour, or whatever your activity tolerance is. And then you might break it up another day. I'm going to do this section. So on a day when you're feeling good, you do a part of it, but the next day you still may not feel as badly. You may not, because you haven't pushed yourself beyond that pain threshold to the extent where you're aggravating your pain. So potentially you can do a little bit every day, or break it up, or set priorities of when you want to get that done, so that you're not planning to do it all on a good day, or, you know, getting a gardening thing done, or something that, you know, the good day, I'm going to do it. Well, no, it's best if you can stretch it out and not do it all on those good days, so that you have more good days and less of that cycling good and bad. Okay. So part of learning to be more active, oh, I think we've got somebody joining at this stage. Maybe I think we lost somebody and she came back to us.
I think so.
Anyways, learning to lead a full and active life. Well, it's likely that if you've got chronic pain, your level of activity and your active life is not going to be what it was before. So unfortunately, the reality is come to a point where possibly we have to accept that this is the new normal. My body's not able to do what it used to do. It can be from an injury. It could be from aging. It could be from a pain condition such as arthritis. But it's important to understand how our pain works and how it impacts us, how it is affecting you and your lifestyle. So that allows us to both understand the pain, but also how our life has changed and how we may have to come to that acceptance of this is me at this time. My lifestyle is not what it used to be. It may very likely never be what it was before you had the pain condition. So using those self-management strategies so that you can still have a quality of life with despite this pain condition, so you have less suffering. We want to wind down the nervous system and break the pain cycle that we've talked about, and improve both the physical and the emotional well-being around managing pain through strategies that we have discussed. And then behavior change is a big part of self-management, because it's a very difficult sometimes to change a habit or a behavior that you've done for many years and that's always worked for you, but doesn't work now. So sometimes recognizing in yourself, okay, sitting and watching TV for an hour or 2 hours or 3 hours, maybe what I do, but maybe that's not so good for me. Maybe that's causing me to become deconditioned and it's causing more pain. Or sometimes just knowing the way you do things or pushing yourself through things to get them done doesn't work anymore. Okay? So just recognizing for yourself, and everybody is different. So if you can start to have more awareness, self-awareness of your behaviors and your habits, that is the start of making change. So awareness comes first. We can't tell you how to do those things because we don't know you and we don't know your habits and your behaviors, but it's important for you to recognize that for yourself. And that is the start for change. Okay.
Some tips for managing your chronic pain. Oh, the baby with the sunglasses is a cute little picture there. So starting with a diet, eating a balanced diet. So that might include following Canada's food guide. Again, Marg and I are occupational therapists. So it's not our specialty. We have a dietitian on our team if this is something that you want to look into. So there's one at the Welland site, I believe, Margaret.
Yes.
Correct me if I'm wrong. Yep. And then we have one as well. So if diet is a particular concern for you and you want to dive in a little bit deeper into more individual therapy with that, we will be sending out a post-feedback survey. So we'll hear from you then. Developing a healthy sleep routine. Easier said than done, right? So going to bed and waking up around the same time would be ideal. Doesn't always happen. Sometimes we have to look at some different strategies. For some people, might include using lavender oil before bed, taking a hot bath with Epsom salt, doing some meditation or yoga to help relax your mind as well as your body. There's lots of apps out there as well. Some popular ones would be Calm, Headspace is another one. Balance is a good one as well too. I like the Balance app. You can really YouTube anything out there these days as well to see what fits best for you. Staying active and pacing yourself, so exercise. This can include, again, it doesn't have to be huge. It might be a goal of yours to take, for example, a short walk, even just up and down the driveway. That might be a goal of yours. Or to walk on a treadmill for 5 minutes a day. Stretching for a couple times a day, just like we practiced here together. That could be a goal of yours. Relaxation techniques and breath breaks. So just as we practice today, engaging in deep breathing and mindfulness throughout the day or during your daily activities may be helpful. Reconnecting social and leisure. So socially might be tricky right now. It might be virtual. There are ways though. A lot of people have been using FaceTime, or as we're using right now, Zoom. We're making it work. There's apps as well out there, like House Party is an app where you can play games with your family, relatives, cousins, to stay in touch with those around the world. And leisure, so always making sure, this is a big thing as OTs, we always want to make sure that you're making time to do something that you love, that you enjoy, even while living with your pain. So yeah, over this pandemic, I know that some things that I like to do for leisure were taken away from me. So I had to get creative. I had to learn new skills and brainstorm different ways. So one example, I like to go to the gym, couldn't do that. So now doing some virtual sessions. So there's always, you gotta think outside of the box for some things. All right.
So one of the, we're coming to the end of this presentation, and one of the things that we can offer and to you, if this is of interest, is a chronic pain group. Historically, we've done a group with face-to-face where we actually got together. Now, with people with chronic pain, often it's very difficult to even just get yourself motivated to get out and go to a group. And some people don't feel that a group fits for them. So groups can be beneficial to try and get you to focus on changing your behavior and some of your lifestyle issues, so that you can learn how to manage your pain and improve some of the ways that you deal with your pain. And what the benefit of a group is that you can hear from others that they may be dealing with the same types of concerns and struggles that you are. And a lot of times we have some of the answers, we have some of the tools, we can give you tools and ideas, but sometimes it's really good to hear from other people who are going through this, things that they've tried, things that have worked for them or not worked for them, the struggles that they've had, so that it gives you that feeling of a bit of, somebody else is going through the same thing. There's a bit of camaraderie there. So we really don't have any dates for groups right now. We will maybe be offering a virtual chronic pain group if there is enough interest. So we're going to ask you if there are people who are interested in that. So if you are interested, we do have the survey at the end, then you can let us know. And if you are interested, it's important that you attend all sessions. So it's usually a 6-week group. And there is learning and practice and focus on behavioral change. And it's important for your own benefit that you participate in all sessions. So you can let us know if that's something for you.
Alternative ideas for managing chronic pain. So there are various routes to go, and some or most of you may have tried some of the things on this slide, or you might be doing them right now. There's physiotherapy and chiropractor. Margaret, I know you are connected with a physio, if you want to talk a little bit about that.
Yeah, so physiotherapy is not always the answer for people with chronic pain. In some situations, it is of benefit, but if your pain is chronic, it may not be making much of a difference at this stage. If you, with the Family Health Team in Welland, we do have some funding for physiotherapy, but it is limited. So if you are with the Welland and McMaster Family Health Team and physiotherapy is something that you feel it would be of benefit to you, you can let me know, because I actually do the screening to see if that's a good choice in terms of treatment. So that's the physiotherapy piece from our side. Massage therapy, if you have the funding or if you have the money, that's a great strategy for dealing with chronic pain. I know that people who have fibromyalgia, it's sometimes it doesn't feel good to be touched. So if you can find a massage therapist who understands fibromyalgia, if you have the money and the funding, they should start very light touch and then work gradually to allow you to work on some of those trigger points that are problematic for you. Okay, so I just wanted to kind of touch on that in terms of fibromyalgia, because I think there are a few people with that issue. Okay, do you want to carry on, Kayla?
Sure, counseling. So counseling is, there's options at both of our family health teams for that through our mental health workers here. We have mental health here at the Virgil site. We have a mental health nurse, we have social worker. It is a bit of a wait list right now, but you can self-refer, or it can go through your physician or another healthcare worker if you're feeling you need more of that mental health counseling. We also have some dates.
I'm just going to interrupt there.
Yeah.
Maybe just back and forth so each person understands. So at the Welland McMaster Family Health Team, we also have counseling, and there is no wait list right now. So if that is something, if you're really struggling with mood, with anxiety, with just coping, and certainly during this pandemic time, it's been more problematic. So if that's something that you feel would be of benefit to you, that is something we can set up for you as well through the family health team. Okay, go ahead.
Yes, we also have single sessions, because we here at the Virgil / Niagara-on-the-Lake / St. Catharines sites, because they have a bit of that waste, they design some single sessions. So again, if you are interested, there are some dates where the mental health team has specific days, and you can just kind of drop in as a one-off and then go from there. So there are some options as well. Just feel free to reach out or contact your physician, and they can send that for you. There's a pain clinic in St. Catharines as well. Oh, medication review. So both of our sites have a pharmacist as well, if that's something you're interested in reviewing your medications with. We'll also include that on the survey if that's something you're interested in. Feel free to reach out as well. Again, your doctor or another healthcare professional on your team can connect you to the pharmacist.
Yeah, so you touched on the pain clinic. So that is, some of you may be familiar with this pain clinic in St. Catharines. I think that the one we're referring to is the one near the St. Catharines Hospital, right, Kayla?
Yes.
So that is, tends to be more focused on medication or injections. So if you're interested in that, you can speak to your physician about that. That is something that's an option for you. And I'll just touch on the mindfulness group. So at the Welland McMaster Family Health Team, we we have had mindfulness groups. We've been doing them virtually in the last year or two. So just learning how to practice mindfulness awareness. So mindfulness is basically awareness in the present moment. So it's not only using breath and meditations, but also just bringing awareness. And it can be a very helpful tool in pain management as well. So Kayla, you want to touch on?
Yes, so acceptance and commitment therapy. So our mental health team, again, this is for Virgil and Niagara-on-the-Lake St. Catharines clients. So they run a virtual ACT group. It's been ongoing, very successful participants. I've gotten really good feedback from the group. So it's titled Living Life to the Fullest. And if you'd like more information for this, again, it's more mental health based. This was as well developed because we have a long wait list for individuals. So this is a group virtual therapy with our mental health team that has done extensive research in this area. So if you'd like to learn more about that, please go to the website. It's niagaranorthfht.ca, and you can look under our programs and resources, and you'll find all the information there. Again, the group is titled Living Life to the Fullest. It will say all the information on our site about how to reach out if you're interested, dates, etc. Okay.
So also, for some of you, yoga can be of great benefit. Obviously, we're not talking about the yoga people that you may have seen pictures of where they can get into these contorted positions. But yoga is more about using your breath to bring your focus to where you are in that moment, to your body awareness, and doing some movements and some stretches, and promoting some more flexibility, some more greater balance, some more strength sometimes, and it can be of benefit for people with pain. If that is something that you're interested in, I am trained in yoga. I have not done anything in the last 2 years because of the restrictions, but I would potentially do an online virtual yoga session, gentle yoga only, if people are interested. There are other yoga programs definitely in your community that's limited right now because of COVID, but you may want to check out sites. Even YouTube sites, there's some nice YouTube yoga trainers. I like Yoga by Adriene. Not all of her sessions would be appropriate for you, but some of them are nice. She just goes through a bit of a flow and just getting you moving. Obviously, anything that you do within your pain tolerances, and always ask, if you really are concerned about your health or your pain, you would ask your doctor first if that's good for you. And finally, one of the things that you can access at the end of the session is if some piece of this really speaks to you in terms of what we talked about today, rather than doing the group focus, you can access either Kayla or myself for individualized occupational therapy in terms of pain management strategies and learning to deal with your pain and what we can do to help you. So that's another choice. So we're giving you some choices. So it's not a one size fits all for all of you. Everybody is different. Everybody is coming at this from a different perspective. So, okay, so that's a good way to lead into this, Kayla. We are sending out surveys at the end of this session. They will be emailed to you, and you can let us know what you thought of this today. So there'll be some questions around that. But also, it's really important for you to start thinking about what are your goals in relation to managing your chronic pain, so that you can answer that question, and that question will be on the survey. So you can think about that. Are you interested in learning how to self-manage living with chronic pain? So that could be working with either your OT individually or in a chronic pain group. There are also chronic pain groups by other, do you remember the name of the other place that offered Stamford?
Yes,
Pain group?
Stamford. I can look it up.
Yeah. So there was another facility that offered chronic pain management, so that there are certainly choices around that. So if you identify that as a need, we can give you information. You can have some choices. So that's the 6-week chronic pain management group is a choice. Are you interested in an individualized assessment or treatment? So that's not just occupational therapy. So if you answer yes to that question, you can also go and answer that a little bit further by saying, you know, it could be occupational therapy, it could be maybe physiotherapy, and we could try and access that for you if that's appropriate. Could be a dietitian referral. You could connect with our pharmacist. We could connect you to mental health counselors or resources. if that's a priority for you at this time. So we'd like to try and, connect you with the right people or programs or tools after this session, so that you're not just, this is a one-time session, but what's the next step from here? Where do you go from here? So we're going to give you that opportunity to tell us what you're looking for. So hopefully this has been of benefit to you. So do you want to turn the recording off?
Yep.
Kayla?